This video is to show you the locations of all the essential health points. The points for well-being, for maintenance, so that horses keep down low-grade pain and so on. Perform an opening procedure first and then onto these points. I always start the well-being points with bar hui, which is not a number on a meridian, but it's on the governing vessel. Find the highest point of the rump, come forward, and there's a soft dip, just an inch or two in front of that high bump. That's bar hui. Now I go forward to the horse's scapula and find the top of the scapula, roll forward feeling the edge to bladder 11, which is in a little niche where the bone joins the cartilage. Bladder 13. Following the line of the scapula over the top, down the back of the scapula, leave one hand there, run up between the ribs to over the shelf of the ribs, slide forward to the back of the scapula, and where it meets the other hand will be bladder 13. Large intestine 16 is on the lower neck. It's on the neck, not on the shoulder, so make sure that you're not on the muscles of the shoulder. Place your fingers in the jugular groove and your thumb at the top of the brachiocephalic muscle. Widen the hand as you slide down the neck, and the thumb will be on large 16 when you slightly lift the muscle. Large intestine 11 is found in two ways. You can feel it when the horse is standing on the leg, or you can feel for it when the leg is up. When standing on the leg, slide your finger from the front to the back until you can find the protrusion of a little bone on the radius. When you find that bone in the crease, go forward the space of one finger into a dip. That's large intestine 11. Or you can face the rear of the horse and pick up the foot as normal, turn around, slide the finger down again, and this time it'll be right in the division of two muscles. Bladder 23 is on the lumbar area of the back muscles. If you draw a line from the top of the point of the hip forward and parallel to the spine to the rear edge of the last rib at the very top of where you can feel it, that becomes the base of an equilateral triangle, and bladder 23, it will be at the top apex of that triangle. It is also above, directly above, the navel and the rear point of the last rib. Bladder 40 is to be found at the very rear of the hind leg. You must lift the leg to find this point, because when the leg is lifted, it becomes a hollow. It's hard to find if the horse is weight bearing. Bladder 60 is on the outside of the hock. Make a line between the point of the hock and the lateral malleolus. On that line in the crease, you will find bladder 60. Gallbladder 34, face the front of the horse holding the tail. Put your hand on the top of the Gaskin muscle. Feel until you can find the nodule of the fibula, the head of the fibula. It's on the outside of the leg, reasonably in the middle. The next point is stomach 36. It's a little tricky to find, but if you face the front of the horse holding the tail, place your hand on the front of the hock and slide up until you feel a slanting bone. At the bottom of the four fingers, you will find stomach 36 slightly to the outside. The last 2 points may not be necessary for every horse all the time. Kidney 3 is on the inside of the hind leg between the point of hock and the medial malleolus, opposite bladder 60. You may need to work both of these points if the horse is very, very large. On a small horse, the light will shine through and either will affect both points. Liver 3 is on the inside rear cannon bone. Slide your fingers up the back of the cannon bone until you feel the lowest edge of the hock bones. You will see that there is a wide vein. Place your light directly over the vein. Horses benefit from these points being stimulated roughly once a week. But if the horse has never had it before, then it's wise to give the horse a bit of a break from hard riding or even riding at all for the first week, and to administer them once every third day. So 3 times in the first week, 2 times for the next 2 weeks, and then once a week after that. If you're stimulating acupoints with a red light, a 660 nanometer red light, follow your supplier's directions as to how long to hold it on. We hold these lights on, which are not terribly high powered, for 10 seconds only. That's all that's necessary to stimulate the body.